Welcome back to the World Extreme Medicine podcast with me, Owen Walker. In this episode, we're speaking with Jørgen Melau for the WEM 2024 conference. So the World Extreme Medicine 2024 conference is here from the 16th to the 18th of November. Today, we're just going to take a look behind the curtains at some of the excellent speaker lineup. So today we have Jørgen Melau with us. Jørgen, welcome to the podcast.
Thank you very much.
It's great to have you with us. Jørgen, I just wondered if you could, for listeners, give us a little bit of your background.
Well, I am a trained paramedic and also a nurse specialized in anesthesia. I also have a background as an officer in a combat-oriented part of the armed forces. Then I worked several years in the ground ambulance and also around 10 years as a rescue paramedic in the air ambulance. Most of that time in the air ambulance I spent in the northern parts of Norway in Arctic conditions. And the last years I have done a Ph.D. in physiology, where I did focus on the physiology of cold water and how our bodies are affected by the cold water. I followed and tested extreme triathlon athletes and also naval special forces operators. At the time, I'm now back in the Norwegian Armed Forces as a researcher and a staff officer, and in a research group that is called the Cold Weather Operations Medical Research Office. I also think for this community, I should mention that I have been a director of the medical and safety crew at Norseman Extreme Triathlon for around 20 years now, which is known for being one of the toughest endurance races in the world. So I think in this community that is it can be very interesting.
Yeah, absolutely, and fascinating. I just wondered, is that going to form the basis of your talk at World Extreme Medicine Conference 2024? Is it going to be on the cold injury organ? And if so, how could you maybe just speak to some of the key points from the talk that people will know more about?
Well, for the talk at this conference, I will be addressing the topics of hypothermia and also general cold weather operations, how to cope with a cold as a medical professional. So the aim of the lecture is to share our knowledge and approach to casualty care in cold weather operations. While hypothermia prevention is crucial among all weather conditions and temperatures, it is much more challenging when the environmental temperature is very low. So, and the thing is that we do have personnel and units in very cold and remote areas. I think that is common for many of the attendants also at the conference. So what we are doing, we are looking very much into what is, at least in the military community, is called prolonged field care. Having a casualty in your care for hours or maybe days in remote areas without help by evacuation. You really have to care for the casualty in very hard and rough environments, and that presents some unique challenges. And yeah, that is some of the things I hope to address during the conference.
Listen, Jørgen, that's fantastic. And I guess just to finish off, could you maybe just give listeners some takeaway points that you'd like to confer to the audience as a little taster for the session?
Well, in general, I don't have a fixed plan for my talk until shortly before the event, because there is so much happening, and I want to stay current and updated during the talk. So I at the moment I can't say exactly what I'm going to lecture at the conference, but my aim is, as I said, to how to prevent hypothermia and also how to treat it. That is one of my main focuses. And one of the challenges is that hypothermia gear is bulky and have a large pack size, and that is not always compliant with our mission. Still, we need to address hypothermia, as hypothermia is a major killer of trauma patients. So if we bring a cold patient to the emergency room, we give him much less chance of survival, and I really hope to address that. I think one of the most important learning points that I always try to share is the fact, or at least I think that is a fact, that knowledge is much more important than the gear you have. Yes, indeed, your gear is important, but very often you need to use what you have, and you even have to improvise. Therefore, you need some basic knowledge of temperature physiology and heat loss and things like that. I also hope to bust some myths about heat loss and hypothermia, because there are a few, and I hope to to be a kind of a myth buster for some of them. And apart from that, I'm really excited about the conference, and I'm very humbled to be able to be among astronauts and very experienced doctors and medics from around the world. So I'm really looking forward to this.
You're going to be fantastic to see there. And so, just to the wider listenership, if you want to check out or indeed interested in Jørgen's research perspectives and indeed insights, please do join us for the World Extreme Medicine 2024 conference. It proves to be excellent in a number of ways, but bringing brilliant minds together like Jørgen's to bear, and indeed to increase the narrative and indeed the discussion on these fantastic topics. Jørgen, thank you for your time today. I look forward to seeing you in November, and I'm sure others will too. Thank you.
Thank you. I'm looking really forward to this.